You mentioned that when you were on your leave, that you realized that you really loved what you do, but you did not love how you had to do it. So could we explore that a little bit more, what you meant by that statement?
Absolutely. I really find it important to kind of meet them where they're at. And so by that, patient-centered care, like I felt was this, and it still is kind of this buzzword that's just sort of thrown out and about. But it's not like, it's not, I don't feel like it's an accurate description. And so that just kind of irked me.
An accurate description of what?
Of the medical community, of the care that we give. Yeah. Because I just feel like it's a pseudonym. Well, it's not even a pseudonym. I just feel like maybe it's a lie. It's just a complete misnomer. Well, and so what I mean by that, so I would have patients call for, I don't know, say the urine symptoms. And so the front desks, by their protocol, they have to put them into a schedule. And then I'll look and see at the end of the day, this acute visit for urine has been put on the schedule. And that's fine. There's nothing wrong with putting that patient on the schedule. But I just, over lunch, I call the patient. I'm like, hey, what's going on? What symptoms are you having? How long have you had them? I'm just going to go order a urine right now so that you can go to the lab and they'll get it started. And then I'll give you a call if it looks like we need to treat you. And then I would just call the front desk and have them take the patient off the schedule because I had taken care of it. And it didn't require an extra visit for the patient. It didn't make her wait several more hours to have an answer to what she needed. And there would be tons of times like that I really would just call the patient, try to talk with them and not make them really inconvenienced, I guess, to come out when they're not feeling well to begin with. And then visits get shorter, the amount of work or boxes that you have to check off gets longer. And pretty soon you're asking Mr. or Mrs. So-and-so to come back to discuss the next couple of things on their list. And that's not really patient-centered either to me, where you have to now split this into 2 visits. So when I said like patient-centered care is kind of a misnomer, I feel like, with reimbursement and quality measures, like it's just sort of become a buzzword for reimbursement. But I get it. I mean, I completely understand, in a health system, what the demands and the needs are and why a schedule is like that.
Can you elaborate on that, since you've been on both sides? So let's put on the other hat and explain why you get it. Like, why are things like that? Mm-hmm.
So like from an administrative standpoint, it really all comes down to needing to meet the bottom line. And so you need X number of patients per provider seen per day so that you can meet the expense for that, and then the larger expense for the practice and the system, plus have some amount of profit at the end of the day. That's where most of those numbers come from. This is the average we can expect to be reimbursed per patient. And so this is what you need to be. And then there's also just the national criteria that kind of get factored into that. You'll often be told, this is the national average for a number of patients seen per day. We need to do that. And from a health system side, I think they're mainly looking at it as being accessible to the patient. They want more visits in a day so they can care for more patients. But doesn't always really feel like that is not quite as cut and dry as that.
For us, by us, and just for us, this is hope for med.